The world is facing unprecedented challenges in the face of global pandemic. COVID-19 killed thousands of people worldwide. This health crisis impact all systems, including education system. Approximately 91.3% students enrolled worldwide are unable to attend school due to COVID pandemic, according to UNESCO. As we move forward with online learning, several initiatives need to be taken in order to avoid boredom of learning process and at the same time improve in understanding. Here in Center of Medical Imaging, we try to convey the technical aspect of using X-ray machine to the medical imaging learning kit. To understand better about this simple and yet impactful, we would like to invite all of you to our short briefing about MIG. We start with the member of our project. So we consist of 5 members in have experience in radiographer. This will result much more understanding of the needs and essential requirement in developing the MIG. The members are as follow. So me, myself, Nurul Diziana Nur Azman, Rafida Sufa, Nur Sadia, Hairina Nur Rashikin and Nur Aiman Baharudin. So this will be outline of this briefing. It is very unfortunate for students who enroll during this pandemic. Due to this situation, they can't even come to campus and having a physical session. Medical imaging program requires students to have enough knowledge and skills, especially in radiographic procedure subject. It is fundamental, but because of COVID-19, all of them are unable to have a very limited access to laboratory practice. Here is the picture of our students in the correct position for medical imaging procedure using a doll. Practical component is one of the most important assessment in this code. With this inability to hands-on in learning, leave a deep gap for the student to understand better about technical aspect. We already identified the problem that might be faced by a student. Pandemic has changed to the normal routine to new normal, from physical lab to the virtual session. Even though a lab demonstration can be done in online platform, but without the actual hands-on, it can create obstacle for a student to imagine and understand well, especially to new student. It also creates a new challenge for educator. They need to find a proper way in explaining and conveying the knowledge. At the same time, students need to adapt the new way of teaching. This has resulted the additive stressor to existing psychology distress among them. By considering all the problem arise, medical imaging learning kit was created. MIG is a learning aid specifically created for medical imaging students with realism in mind. It mimics setting of X-ray laboratory, which consists X-ray machine, X-ray tube, positioning light and collimator box. It stimulates various patient positioning, thus allowing better application of knowledge. Because of its mobility, it can be used almost anywhere, and this allows to students to practice at their own accord without needs to be in lab. In developing a MIG, we believe learning that doesn't have to be boring. We believe that MIG could help enhancing student learning experience. It will also allow learning flexibility and better visualization of radiographic procedure compared to the regular video demonstration. This will also boost the confidence among students. We want to ensure that medical imaging graduates possess that necessary technical skill to be a competent radiographer. Adapted from Euro machine, MIG invented with 2 main components, which are X-ray tube, consists of collimator line and adjustable collimator box, which can adjust the size of collimation according to patient structure size. X-ray tube can be adjusted with a different orientation and angulation according to radiographic projection. All above being supported by the X-ray machine as shown in this slide. We believe this product can be commercialized not only for UiTM students but also for other institutions that offer similar program. By having this design pattern, we are not just helping harvesting the skill needed to become a radiographer, but also harvesting income for UiTM. In developing a product, one should have a meticulous projection of the costs involved. Here are the costs needed in making a MIG. By having the retail price around 80 ringgit, we estimate to make 13 ringgit as profit. But of course, if we can find a cheaper raw material, we can earn more. As previous mentioned, this product is result from the some restriction in learning process. We did try to look for the similar product that probably already available in market, but we couldn't find one. Thus, we can safely say that this probably the first product of this kind with this idea of helping medical imaging students honing their skill. As a conclusion, even though the creation of medical imaging, which is made, it is important for students to still practice using a real machine, even with minimal exposure. This kit is not a replacement, but rather as a tool to help students in their learning.
New normal has taught us to be more creative and innovative to make sure learning and teaching process still continue from physical lab session to virtual session. Medical Imaging Learning Kit (MILK) is a learning aid for medical imaging students. It mimics the setting at the X-ray laboratory to enhance the student's skill in performing general radiographic procedure. MILK is equipped with an X-ray machine structure, X-ray tube, positioning light and collimator box. It can be used to simulate various patient positioning. It also needs few steps to assemble. MILK aims in enhancing students' learning experience and better academic achievement. It allows learning flexibility and gives opportunity for longer training hours. We believe that MILK can help in strengthening the students' psychomotor skill, which will greatly benefit them, particularly during their clinical attachment. We are also aiming for a possibility of commercializing this product not only for UiTM but also for other institutions.